I'm old school, so I'm doing paper. But welcome everyone. Yeah, I was like, I'm going to go last, but here I am. So hopefully Mina can get hers working. So my name is Tanya Kulikowsky, and I'm currently completing my degree in public health at the University of Victoria. I completed my practicum at the Ministry of Children and Family Development with the Out of Care Kinship team, and I'm really excited to share some of my experiences with you. First, I want to start with a territory acknowledgement, not just to recognize the land, but to reflect on the long-standing relationships Indigenous peoples have with these territories. As Lempierre reminds us, this is not just a formality. It is an opportunity to learn whose territory we're on, reflect on our relationship to it, and ground the work in humility and awareness of the broader history that shapes the systems we're part of. I am grateful to work and learn on the traditional territories of the Lekwungen-speaking people, the Songhees and Esquimalt nations, and the Wasanich peoples, including the Pocatchin, Sayout, Sartlip, and Sagum. And the photos that you see here is where I was located at the Chatterton office, and across the street we had Rithit's Bog. And so you can see this was our lunch break, so we'd always go and connect. And because we had so many different roles, really the only time we could connect with each other was over lunch. So it was a great way to connect. So who am I? I will briefly situate myself in relation to the territories where I live. I am of settler heritage with Latvian roots on my father's side and Polish-Ukrainian on my mother's. I grew up on Treaty 1 territory in Manitoba and moved to Lekwungen territory in the early 90s. Today, I live in the Cowichan Valley on the traditional territory of the Cowichan peoples. I work as a family support worker at Saanich Neighborhood Place, where I've been for 9 years, and I'm currently completing my degree in public health with an Indigenous focus at the University of Victoria. And the photos here are of Cobble Hill Mountain, which is in my backyard, and I hike that regularly. My kids, Anna and James, with privacy respected, and my cat, Mitsu, who thinks she's actually hiding behind that piece of grass. So what does the kinship team do? The kinship team supports caregivers who are caring for children who can't safely stay with their parents, helping place them with extended family or trusted connections with a focus on reunification or permanent placement. In this role, I supported the kinship assessment process, joint home visits, and team discussions, and started seeing how policy actually plays out. I also helped with documentation and observed how workers assess safety, risk, caregiver capacity. What stood out early on was how much happens behind the scenes, not just working with families, but in the level of thought and care behind each decision. As a family support worker, this really mattered to me because understanding the process helps me better support families in my day-to-day work. As a family support worker, as it also gave me a great chance to build connections, and honestly, I had a lot of fun. It was a great team to be a part of. So during my practicum, I focused on developing several PHSP competencies, including communication, collaboration, cultural safety, and ethical practice. For this presentation, I'll focus on ethical practice and cultural safety, as they were both central to the kinship assessment process. One example of this was navigating what I think of as wearing two hats. My background as family support worker encourages a supportive, strength-based approach with families, and at the same time, the kinship assessment role requires objective documentation that involves placement decisions. In one situation, a family I was supporting through my community work was also connected to the kinship office. That meant I had to be very clear about the role I was in, both with the family and with the team, to maintain appropriate boundaries and support with the best possible outcomes. Cultural safety was also an important part of this, because being mindful of how my role within the government system may be experienced by families, and making sure my approach stayed grounded in respect, humility, and awareness of the broader systemic impacts. One key knowledge area from my practicum was the role of social determinants of health in kinship care. Through the assessment process, I saw how factors like housing stability, income, and family support networks directly shape a caregiver's ability to take on this role. I also saw how kinship care supports stability and connection for children, allowing them to remain connected to family, culture, and community. In many situations, grandparents were stepping into caregiving roles, often unexpectedly and with limited financial and formal supports. Even with those challenges, research shows that children in kinship care often experience greater stability and better outcomes compared to traditional foster care. This highlighted for me how important it is for workers to help families navigate systems, access resources, and understand processes that can otherwise feel overwhelming. One example of truth and reconciliation in practice I observed is the growing role of Indigenous-led child and family service organizations. The TRC of Canada Call to Action Number 1 calls on governments to reduce the number of Indigenous children in care and support families and communities in caring for their own children. It is important to acknowledge that Indigenous children are still significantly overrepresented in the child welfare system, reflecting the ongoing impacts of colonial policies that disrupted families, culture, and community connections. During my practicum, I saw Island Métis Family and Community Services begin supporting Métis child and family service files. Families were also given the choice to transfer services, and this choice, and some chose to stay with their current workers based on existing relationships and trust. And I think honoring that choice is important. I also saw the role of Indigenous organizations like Nitwa and Surrounded by Cedar in providing culturally grounded support for their families. This shift represents meaningful steps towards supporting families in ways that are more connected to culture, community, and self-determination. One key insight from this practicum was gaining a deeper understanding of the stories behind the names in the files. In my role as a family support worker, I already approach families with relationships and lived experience. What this practicum added was a systems and policies perspective. I began to see how documentation, assessments, and decisions within the system interact with the complex family realities that already exist. This deepened my understanding of how important thoughtful and ethical practice is, because those system decisions ultimately affect real families and relationships. And one thing that I'm really proud of is creating the CAT cheat sheet for the team. The Kinship Assessment Tool, or CAT as we call it, is the guide workers use to cover key areas during the kinship assessment. I turned it into a quick point form reference tool so workers can use it during conversations with families. The goal was to keep the interactions more relational and conversational instead of feeling like a checklist. It also gave me a chance to really deep dive into this process myself. Since I wasn't able to follow a file from start to finish, creating the cheat sheet helped me better understand the structure and purpose of the work, and that allowed me to contribute something practical to the team. And yeah, that's it. I want to thank Leah, my supervisor. She was amazing, and I'm just really thankful that I was placed on this team. And the whole Chatterton office and kinship team, it was really an amazing experience. And I, of course, have to thank my team at Saanich Neighborhood Place, because without them, I wouldn't have been able to do my practicum. So they were able to help me balance work and practicum. And thank you to Natalie for your guidance through this practicum experience and the whole Public Health and Social Policy School.